Morning, everybody. If I could have committee members please take their seats. We're about to begin. Welcome to meeting 28 of the Community Development and Recreation Committee. Welcome to members of the committee and other members of council, like Councillor Layton, for instance. For those in the room with us, the screen at the back of the room provides real-time updates concerning where we are on the agenda, what's coming up next, and some Netflix highlights. You can also follow the agenda and debate on your... Oh, you caught that one, didn't you? You can follow the agenda and debate on your computer, tablet, or smartphone at toronto.ca/council. I'm looking for any declarations of interest under the Municipal Conflict of Interest Act. No? Confirmation of the minutes from April the 12th, 2018. Councillor Cressy. Councillor Ford, all those in favor? Opposed? That is carried. So we now go through the agenda. We'll hold item 1 as we have a deputant. Item 2, award contracts to Motorola Solutions Canada Inc. for radio replacement Lifecycle project.
Move approval.
Move approval. All those in favor? Opposed? That's carried. I've never seen $18 million spent so quickly.
That's what we do on this committee, tax and spend.
We know how to spend money here, that's for sure.
Sure, yeah, that's us.
Regulate, tax spend.
Regulate and regulate.
Item number 3, 2018 allocations recommendations for Community Investment Fund and Community Service Partnerships Fund.
I'll hold that for Councillor Layton. Who wants to make a speech?
Held by Councillor Cressy. That. Well, we'll hold it down. If Councillor Layton wants to ask questions of staff or speak to it, that's fine. Item number 4, status of negotiation on shared use agreements with the Toronto District School Board.
Oh, sorry. I'd like to hold that, please.
Held by Councillor Fletcher. Item number 5, suitability of identified property as a proposed shelter. This was a deferred item, and it also is accompanied by a confidential report.
I'm holding it.
And that's being held too by Councillor Fletcher. Item number 6, exploring sites in Liberty Village, Fort York, Niagara neighborhoods for potential community uses. This is a letter from Councillor Layton. Moved by Councillor Cressy. All those in favor? Opposed? That is carried.
Mr. Chair, I have a new business item I'd like to table today, please. Pardon?
Sure. Does the clerk have it? We can.
No, clerk's get it. No, it's being sent to the clerk now.
All right. Well, we'll have it circulated. Why don't we have it circulated?
Yes, that would be great. Thank
And
you.
then we'll see whether we want to add it to the agenda.
You know, I understand.
Item number 1,
Got it.
Ontario's action plan for seniors includes a focus on long-term care.
I'll just.
Mary Hines is here to talk to us. Thank you very much, Mary, for coming. You have 5 minutes.
You know what?
You can have more than 5 minutes.
Hi, I'm speaking here today for Minnehaha. I am a representative of the Old Women's Network, an original member of the Accountability Table, a member of the Ministry for Seniors Liaison Committee, a student at U of T Research for Senior Resilience, and a senior, or more properly, an older adult. I heartily endorse City Council seeking available and not yet available provincial funding to expand long-term care beds, but there is more to be done. Ontario's Action Plan for Seniors claims Queen's Park has plans that will help older adults live independently in their communities as long as possible, as well as supports for frail older adults who require long-term care. This could be an opportunity for the city to leverage new funding for services to delay the need for long-term care for some, possibly many, older adults. Community-based programs co-located with long-term care facilities could be used by residents and community members to provide the continuum of care in the recommendations. Community programs can help prevent isolation in older adults. Prevention of isolation reduces loneliness. Reduction of loneliness leads to reduction of depression and mental illness. Depression and mental illness lead to both social and financial costs. Prevention, or more accurately, delay of dementia, can contribute immensely to reducing social and financial costs for the province and the city. Older persons hubs co-located with long-term care residences will be places for physical activities and exercise. They will be places for social interaction and places for mental stimulation. And they can be places for residents and community members to just be together. Research is showing that combining physical activity, social interaction, and mental stimulation can stave off dementia. Next week, Executive Committee will deal with items relating to the senior strategy and the Tenants First policy. Assuming all three items move ahead in some fashion to City Council, it is crucial that they are not hived off into separate silos for implementation. All three items have much to be shared. I am perfectly aware that this is the only one of the three to be dealt with today, but please think of this as part of a much bigger picture. If the promised funding comes to fruition, negotiate for older persons hubs in long-term care facilities. Older persons hubs should be an important public health initiative as part of older persons' social housing and long-term care. Thank you.
Great, thank you, Mary. Questions for the deputant?
Yes.
Councillor Fletcher?
Go ahead. I thought Councillor Cressy was going ahead. Oh, okay. Thank you. So you're supporting the Tenants First policy that would
Yes,
establish...
as it is, yes.
As it is, not to change it and to create another unit or special seniors housing within the city, and that would merge with or have long-term care.
Well, that's part of the proposal.
Yeah, I'm asking if you support it.
Yes,
Not-
do that, yes.
Thank you, because you're aware some people might want to try to change it at this point.
No, at this point, I think it should stay the way it is. It needs to go on. I mean, I don't see it as a perfect solution, but I think it's okay as it is. When I'm
Thank
in
you.
council, I will support it.
And are you aware of the long-term beds or the long-term care homes that aren't run by the city, but
Yes.
that are now moving out of the city? Are you aware of this situation that we currently have?
I know some are closing. Yes, I'm aware of that.
They're not closing, they're relocating
Well,
out of
they're
neighborhoods.
giving us, they're moving out of our area.
How important do you think it is for families to have their elderly loved ones close by in the long-term care?
It certainly is an important thing for most families, yes.
Not to have to go
Well, of course, yes.
25 kilometers. In other words, long-term care established in communities where you can visit the person, augment their meals, bring them things, crisis, you can
Well,
be there very
especially the
quickly.
visiting piece, because expecting families to do a lot of the actual social supports is definitely a strain on families. But I know with the current situation with the LHINs, many people are sent, like from, for instance, the central LHINs, people are sent off to the far areas because it's still part of the same LHIN.
Yes, so it doesn't work very well.
So certainly as many long-term care beds as possible should be located within the city. But long-term care beds are an endless ocean. We can never build enough.
I'm not talking about the building. I'm talking about the current ones that are being relocated, the capacity being relocated.
I see that as a problem,
I
yes.
see that as a problem. Thank you. I just wanted to hear what you thought about that. I think it might be an emerging crisis, and you're confirming that it's a
Yes.
very difficult thing for communities to have.
Yes.
And the cost of land is so high, assuming you could never build the same type of home that it might be leaving.
I think it would be a big problem, yes.
Thank you. Thank you.
Thank you, Councillor Fletcher. Any other questions for the deputant? No, thank you very much, Mayor.
You're welcome.
Questions for staff? Councillor Mihevc.
Yes, thank you very much to staff for your report, Reg. I'm looking at page 7 of it, and, parochialist as I am, I'm looking at Castleview Witchwood Towers as an example. And I think it applies to really, frankly, all of them. Am I reading this right? So current beds in total, we have 1,232 in the ones that where renewal is happening or where a new site is being found. That's what that first column is, correct?
Through the chair, that is correct, Councillor.
And the second column is basically how, after all of them get renovated over the next, 10, 15 years, we will have 1,232 beds, like for like, basically, on a system-wide basis. Is that fair to say, too, for the second column?
Through the chair, that is also correct. That is the plan that we had submitted to Council in 2015 to redevelop the homes that were designated as mandatory redevelopment. And in that report, we acknowledged that we were working with the current inventory and it was not forward-looking. It was simply how to redevelop the existing homes and beds.
And the third column is that if we wanted to, as a city, with the support of the province, we would have capacity in all these locations on a system-wide basis to not go with 1232, but to go as high as 2018 if we were to maximize our capacity at each of these sites. Is that fair?
Through the chair, that is also correct, Councillor, and it's simply indicating that if we were to, as a city, to redevelop those properties, the maximum numbers that we could put on those sites through consultants' assessments, those would be the maximum numbers possible.
Okay, so let's go then sideways and use Castleview Witchwood Towers as an example. It's an amazing facility. I love going there. When I was a kid, I used to actually work at one of the sites. I worked as a janitor, mopping floors in high school at Lambert Lodge, which was across the street from Castleview Witchwood, which is now Castleview Witchwood. So right now we have 456 beds, planned beds. When we not, and I know that there's a cascading. We got to do George Street, and then Castleview Witchwood Towers comes into play. We basically decant that place. Planned beds, though, are 256 beds. That's the current plan. Is that fair to say, too?
That is the existing plan that was approved by Council.
And we need to figure out a way, if we approve this report, or what do I need to do, given that I think you're saying we could double. That's a humongous site. It's a very large site. Lots of capacity there. We could go to 512 if we wanted to. Okay. Sorry, and a few dollars later.
Through the chair, and just to clarify, approval of this report is not to do anything specific at this point, but really to go back to the ministry, to different ministries perhaps within the province as well, because there's dollars that are available but not currently integrated that could be used by the city. Currently, frankly, the Ministry of Health and Long-Term Care has approached the city, and even specific to this site, about adding beds, because their inquiry was, at the time we had submitted following Council's approval, was to indicate what space was available on those sites, because land is the problem in redeveloping long.
Okay, so what do we need to do to support you in, well, there's a number of them when you go across. Esther Shiner Boulevard is another example. We could go up to 428 there. What do you need to hear from us to support you in any way we can to get you to work towards a 2018 capacity rather than a 1,232? Do we need to officially say, would it be helpful if we officially said as council that our goal as a city is to maximize through the capital renewal bed plan, bed allocation allocation and location capacity study or work to go to 1218. Is that fair? Would that be our official position?
Through the chair, yeah, we will, as staff, take any direction that we receive from council, of course. And right now, what this report seeks to do is remind what directions we have already received to date to begin that greater dialogue. The biggest issue, of course, for the city ultimately is service in long-term care, service for seniors. And there is a risk of the loss of beds generally, not just those operated by the city, of course,
yes,
but just in general. And that is part of what this request is, to be able to advance those discussions to ensure that services are available.
And last question, if I might, and this will involve shelter, housing, and support. So if we were to go to 1218, even if we weren't, frankly, but if we were to go to 1218 as our stated goal as a city, you folks are chatting with each other, right? So we have had a homeless community for, well, a rising homeless community for 30 years. Many of them do make seniors. They don't all die young. And they have unique needs. If you've been street involved for a long period of time within the shelter system, and now you're a senior, that's a possibility, right? Is that a possibility to have this kind of collaboration? And I'm sure you guys are thinking about it. Maybe you can articulate how you're thinking about it.
So through the chair, so we are working very closely together on a number of streams. So under leadership of Chris Brillinger on the tenants first side, but also Reg and I co-chair the George Street transition plan. And in that new site on George Street, there is a combination of shelter, affordable housing, a couple different shelter programs, long-term care program, community hub, and those types of things. And the idea is to create exactly what you're talking about, which is this transition plan for those individuals who have been long-term shelter users to be able to move from a shelter program, if necessary, into long-term care within the same facility.
And are you looking at doing that, a similar kind of thing with, well, the next one after George Street is Castleview-Wychwood, right? Right?
That is correct. That is our current plan that has been approved by council. And what we are looking to do is establish partnerships, linkages, certainly with other city program areas, but also with local community organizations as well, to partner and move services into areas that are currently underserved and people that are not well served.
Right. Okay, great. Thank you. Thank you, Mr. Chair.
Yes, no, I do apologize. Thank you, Councillor Mihevc. Any other questions for staff? Councillor Fletcher?
There were regulations brought in the province about naming or giving a level to long-term care beds and phasing out certain long-term care homes or beds that don't reach a B, I believe. Can you tell us a little bit more about that?
Through the chair, yes. I believe you're referring to the structural classification of long-term care homes. Those homes that back in 1998 that were deemed totally unacceptable were labeled as D. The City of Toronto had 2 homes that were D, and those homes had been redeveloped. Those were True Davidson Acres and Westburn Manor, which replaced Albion Lodge as
Sorry, it's very hard for me to hear you. If you could speak up, it would be great.
Move the microphone a little closer. So we also have in the city homes that are designated as A, B, or C. C and B homes are now those that are part of this mandatory redevelopment program, and those have been listed on page 7 of the report.
I'm not speaking just about city-owned. I'm speaking about the structural classifications overall that the province has laid out. And
Yes. Yes, so in the report, it also identifies the number of homes within the City of Toronto. There are 84 homes in all, 50 of which are for mandatory redevelopment, which is why there is heightened awareness, because these homes, their operators are either planning to relocate, to close, return the beds to the province because of the challenges, particularly around land, but there's other affordability issues, which is why the city as a whole is at some risk of
Right.
losing long-term care.
I just want to ask our acting DCM, the city is the service manager for childcare in the city, is that right?
Yes, that's correct.
And the city is the service manager for housing in the city?
That's correct.
But the city has nothing to do with long-term care. We're not the service manager.
No, that's divided between the 5 LHINs, and part of what the report is saying is the need to strengthen the city's role in that function.
Could we not ask to be the city, under the City of Toronto Act, or in some way that we could be the service manager for?
It would be a request of the Ministry of Long-Term Care, because I believe it's spelled out in their regulations.
So City Council could ask.
Yes, they could.
And I just want to go back to the number of homes now with the, excuse me,
Reg?
Sorry, my apologies.
the total number of long-term care homes in the city, you said was 80? 84?
There are 84 long-term care homes.
84 long-term care homes, and 50 don't meet the current standard and must be redeveloped.
That is
They are at a C or below, or a B or below.
a B or a C.
50 to be redeveloped because they're a B or a C. And then how many of the 50 are any of the 50 City of Toronto owned? How many?
Through the chair, there are 5.
5. So there's 5 City of Toronto, 45. And would you say most of those, how are they located throughout the city? Because now there's 34 that are okay, 50 that need to be redeveloped. And where would they be relocated? Do we have that map, or do we have an idea exactly where those 50 are?
We do have a listing of all homes in the city. I'm sorry I don't have that here with me. What we don't know is where different organizations are in their own planning, because even though they've disclosed, some of them have disclosed to the ministry and some have disclosed to the LHINs, it's still considered proprietary.
But you have a map. You could show us where the 34 are that are currently within standard, and of the 34, how many of those are city homes? Sorry, I should have got that from you.
We have, the city operates 10 long-term care homes, so 5 are either A or designated as new build.
Right,
and
so
5
5 are okay, and 10 need to be redeveloped. You could provide a map that said, here's the City of Toronto, here's where all of the 80 are located, and here are the 50 that are up for mandatory redevelopment. Is that possible to provide that?
I do know we know all of the homes across the city. We do have a map of that, and as far as the B and C identification, we could probably clarify that as
So
well.
we could have that list for council, let's say. If I was to move a motion that City Council request that the province of Ontario allow the City of Toronto to be the service manager for long-term care.
You could ask that, yes.
Okay, I'm going to ask that. Thank you.
Thank you, Councillor Fletcher. We look forward to your motion. Any other questions for staff? I just have a couple. Oh, look who popped in. Councillor Davis.
I just heard the discussion, was watching it in my office. What I wondered was whether there is a standard for measuring levels of service for long-term care. And are there examples of it in other jurisdictions? For instance, we should have so much long-term care per capita. are there other plans in other jurisdictions that we should be looking at for how we prepare and measure the need for the future?
You seem to be looking this way. Is there someone in particular you would like to?
To the staff.
Well, the staff are all over the place.
To Reg.
Okay.
Through the chair, the province of Ontario has done a capacity plan, or sorry, a capacity assessment, I should say.
Yes.
They have not released that information publicly, as well as each of the, well, I won't say each of them, but some of the LHINs have done their own capacity assessments and have been working with the province. We have not been privy to that information, save and except in some closed meetings where the information that was made available to those of us who participated was under confidentiality agreements. So we just don't have the information publicly available from a capacity standpoint.
I find that remarkable. So there is currently in the province of Ontario no public document which talks about the needs and the capacity that needs to be created to meet that growing need.
Through the chair, the only thing that has been made public, I guess, is the fact on the Ontario Action Plan for Seniors.
Yes.
Indicated that the current government has committed to 30,000 beds over the next decade.
Yes.
Depending on the different platforms of the three main political parties, there's different numbers that are being identified. So that is what we know is what the commitment is being made, but not
By the government. The government has just made this promise recently.
Through the chair, the promise or the commitment that was made late 2017.
Right.
And there was a consultation that was conducted by the province through the Ministry of Health and Long-Term Care earlier this year, of which we had provided informal input.
And so what input did we provide? What is have you already identified the demand?
Sorry, not from a demand standpoint. The consultation was more around the how, and it was through focus groups.
Mr. Chair.
So there wasn't a written submission.
Oh, you participated in focus groups?
That is correct, Councillor.
Wow. If that's the level of input that the largest city has for planning the growth of one of the most important and growing services that we need, that is shocking to me. So there really is no plan that is public based on that input. What was it called? A capacity?
Through the chair, what the Ministry of Health and Long-Term Care had embarked on a year and a half, 2 years ago was a capacity assessment. But that information was not released. What was released was the commitment to add 30,000 beds.
So we don't know if the 30,000 beds, excuse me, there's just so much talking up here. I can't even hear. So we have no idea whether 30,000 over 10 years for the entire province is anywhere near what the capacity assessment may have identified.
Through the chair, that is correct. We don't know what the real need is, and we don't know where those 30,000 beds are necessarily going to be allocated across the province.
Based on, you may have answered this already, Reg, based on population, how many beds should we get? If you only did it crudely that way.
I can only indicate in general terms, and the report does speak to the fact that,
Yeah, I read that.
based on population, based on percentages of age groupings, we believe the city is falling behind in meeting the need. There is an erosion.
No, but of the 30,000, how much should we get? A
This is
quarter?
your last question, Councillor
third?
Davis.
I'm sorry, Councillor, I don't know that because we haven't done the assessment piece of it, because as was referenced earlier, it is the ministry and it is the LINs who take carriage of the service planning. We are a partner.
Okay.
Okay, thank you, Councillor Davis. Any other questions for staff other than a couple I have? Right. So on page 8 of the report, it references municipalities are the only service providers in the province of Ontario that are required by legislation to deliver long-term care services. But there's no parameters on the volume of beds under that legislation it was kind of referenced cryptically earlier about a per capita requirement or so forth. We inherited these 10 homes from legacy municipalities. Is that similar across towns and cities in Ontario?
Well, yes, and it was through the metro level of government before, so the long-term care homes known as Homes for the Aged in the day was being managed as a single service to all of those original local municipalities. The ministry, the province, the government has frankly refused to articulate what is meant by that. It is, I suppose, a foothold to ensure that if no one else will provide the service, that there will be a service provider to meet the needs of local populations. So the city has always done it on the basis of proportion. That's how we have looked at it in the past, and City of Toronto, as a municipal provider, has fallen behind many of the other municipalities as a percentage of need being met.
Well, certainly Toronto is a unique case because of land values and the complexity and difficulty of building new. Nothing against our good friends in Windsor and Niagara Falls and Brantford and so forth, but I would say in those jurisdictions it might be a little easier to keep up.
That is perhaps true. I can't speak to that.
So not only do we not receive sufficient funds for initial capital, but once up and running, the operating is problematic as well based on this report.
There is need on both capital and operating.
So is your recommendation that we hold the fort on a number of locations, but we build capacity within the envelope?
Just to clarify, the motion isn't taking one position, or sorry, the recommendation, I should say, is not taking a position. It's just saying we need more information. We need to represent what council has directed us to do to date, and further those discussions with the ministry, and to not just look at it being a long-term care home, but a hub, a community hub, a campus, looking at different opportunities. George Street redevelopment is a great example of where we are integrating services, but there is not a clear model for funding unique situations such as that, or even how to address the current unmet needs, those individuals who are hard to serve, and we just want to advance some of those discussions.
Okay. Any other questions for staff? Thank you. We can go to speakers.
Just take a second, Mr. Chair, while we get the motions organized.
Councillor Mahevik, is your motion ready? Great, so you're welcome to speak.
Read it, council adopt the goal it's not the year 2018, it's the number of bids. Just by the way, it happens to be the year that we're in. But it's the goal of 2018 bids as proposed in Table 2 of the report as the city target in the long-term care homes and services capital renewal plan. There should be a semicolon there just to make sure the Queen's happy. And further request the general manager long-term care homes and services to continue collaboration with shelter, support, and housing administration, social development, finance and administration, and other city divisions in the renewal and redevelopment of these sites. So, you know, recognizing, I think Mary's point is well taken. We, given the dynamic that's out there in the city with the private sector leaving Toronto because of the high price of land, we can't fill all of that gap, but we can fill some of it. And why would we not maximize the assets that we already have? I'll give you an example. Casa v. Witchwood on Christie Street, just north of DuPont. It's a massive piece of land. Our staff are saying that you could actually comfortably double the amount of people there on the same property and provide that much as support. That seems to be eminently a wise use of a scarce resource, namely the property. So that should be our position as council. Right now, our position is actually to replace like for like, so go to the same number as before. Add into that, we need to wave in another layer, at least another layer, given our housing crisis with shelter housing and support. They're already doing great work on that at George Street. I think we've heard a few reports on that. But that should be a systemic way of us doing all the renewals of our long-term care facilities, at least that it's part of the considerations as each project is being developed over the next decade or so, about decade or so. So that's what this motion tries to do. It supports staff in continuing the good work that they are doing, and it establishes a target so that we're we're going from 1,200 to 2,000. That, I think, has to be our goal as a City of Toronto. That doesn't mean maybe, you know, depending on who the government is and depending on goals and pressures and politics, we might not reach 2018, but it should be on the table as each site is developed. So that's the purpose of my motion. Thank you very much, Mr. Speaker. Mr. Chair.
Thank you, Councillor Mihevc. Any questions for the mover? No? Okay. Councillor Fletcher, is your motion ready?
Yes, I have two motions.
Two motions,
Sure.
okay, great.
Motion A and
You can
motion
see them on the
B.
screen.
Motion A is just coming hot off the press, hot out of the printer. Motion B, this is A, that we direct the General Manager of Long-Term Care Homes and Services to include in the discussion with the Province of Ontario an explanation on the feasibility and implications. Oh, sorry. An exploration of the feasibility and implications of designating the City of Toronto as the service manager for long-term care facilities and services in Toronto, recognizing that currently it's split between 5 LHINs and is not working. And number 2, the General Manager of Long-Term Care Homes and Services report directly to City Council to provide a map that outlines the location of the 84 long-term care facilities in Toronto, highlighting those operated by the city and all of those requiring mandatory development. And I'm moving both of these motions here because I believe we have a crisis in our city regarding long-term care. We have 84 long-term care facilities where the loved ones of many families go when they're elderly and they get care till the end of their lives. There is a crisis due to what is called the structural classifications that our General Manager described, and in the precise requirement for long-term care homes that have been operating very successfully, that have upgraded many parts of their life systems. However, they don't meet all of the requirements. And I will give you one example with a home on Queen Street that has air conditioning in every room, that has lifts in every room, that meets so many standards that are A standards. But because it was built in the 70s, the hallways are 1 foot too short to be classified as an A. It is a C, and it has to be redeveloped. My friends, Where in the city of Toronto are you going to get enough land to redevelop a long-term care home? The cost of land is exorbitant. I don't even think we looked at a long-term care home when we did West Don Lands. When we're even looking at planned communities where we own the land, we're looking at childcare centers. So I'll probably move later that we look at one of these somewhere in the Portlands and Villiers Island. But there are people, very low-income people. Many of these homes are for people on modest incomes. Their families live in the neighborhood. They supplement and augment the care that exists there already, and we're all well aware of what goes on in hospitals. So to have your family close by is one of the most important things for long-term care. And what we're setting up now is all of these beds leaving the city, moving to Markham, moving to Innisfil, moving to Barrie, where land is cheaper, where when they reach the end of their life cycle at a C+ and can't stay, they're now leaving Toronto. They're leaving our neighborhoods. And the map, I want everybody to see, there are 50 homes where the relatives and families of our constituents visit and look after their loved ones in long-term care homes. This is split across the unmanageable, unconscionable LHIN system, which has broken up healthcare in a way that is absolutely not delivering anything that's needed in the city. And I'm going to give you one other example of this very table. We said there should be a health requirement in the new shelter at Hope Leslieville. The mayor came and announced it with the minister. The LHINs have announced it again. That person is still not there 6 months later, and it is the LHINs that is responsible to put that person in there. There is no ability to act quickly on the demands and requirements of the system. And we have an aging population. We have people that want to age in place and move to long-term care. It is just ridiculous what we're faced with here. And I'm very happy that our general manager has brought this report. I know that our deputy city manager, who's now the acting interim city manager, and our acting deputy city manager are all seized with this, because if we're looking around at what a crisis is, it's this. And people that are looking after their parents and older folks in long-term care homes, they're not knocking on the door the way parents are that need childcare, but they should be, and they will be soon. If everybody understood how broken this system is, we would have people lined up at the door. So I hope by this request, we're actually going to marshal our forces to tell the story of what's going to happen to those people in Toronto that will have no more access to long-term care in their neighborhoods, and those families that will have no more access to their own families in a close-by setting, by transit or anything else. So I'm very, very upset. I'm concerned about this. I've talked about this a lot. I'm happy this report is here. And probably when we get that map, at least if we could know the number of beds that we're looking at here, that will affect many citizens in our city. Thank you very much.
Thank you, Councillor Fletcher. And certainly in Ward 10, our LHIN, the central LHIN, gave the green light to North York General Hospital to close the Branson Urgent Care Centre, not a long-term care facility, but a vital community medical facility for seniors. It was had repercussions, very serious repercussions in the neighborhood. Any other speakers? No.
I do.
Okay, well, let's...
I want to speak.
Councillor Davis.
Thank you. And I absolutely concur with the assessment that Councillor Fletcher has made. One of the things that I learned from the report and from the general manager, and I have a motion that I hope we can get up soon, and I apologize because it popped into my head, which is we should work to develop a capacity assessment for Toronto. There is not a capacity.
Is there a committee member taking? Okay.
So there has been a capacity assessment done for the province, which is being held in confidence by the provincial government, but there isn't anyone doing a capacity assessment for the City of Toronto. And it's because the LHINs are broken up, and it's true, we don't have we are partners, but we don't have any particular role in developing that. So that motion could say, you know, work to develop it in partnership with others if that's necessary. But I think it should be that the deputy city manager work to develop a capacity assessment for long-term care services in the City of Toronto. I actually have spent a lot of time in long-term care facilities this week and over the last few years with members of my family who have aged and passed on. And one of the things that has really surprised me is the lack of planning and the incredible stress it places on families trying to navigate through this system to get the kind of services that are necessary for your family. I know that the City of Toronto has been a leader. Thank you very much, Carol. But we haven't been able to advance this agenda in the way we should as the largest city in the province. So I will just leave it at that. Other than just say the tsunami, the gray tsunami that everyone is talking about has not been addressed in terms of long-term care services that I can see. And the report demonstrates that the per capita at 2011, there was 0.68 beds per 100 seniors. But by 2041, there will be 0.31. And for older seniors, it will be 0.55. So we are seeing the decline on a per capita basis overall. And I want to really understand what it means for Toronto. And whether or not we have jurisdiction, I think we have an obligation to be advancing and advocating. And we could do it when we understand better what the capacity needs are for our system. Anyone who's been in a long-term care facility certainly knows that the client base we're serving now in our homes in particular is older, more frail, more complex, and the nature of long-term care has changed so much in the last 10 or 20 years because we have been only dealing with those with the most challenging of needs. So we need to move beyond that, and I hope that we can understand better the needs of the City of Toronto and be a strong advocate with the provincial government. Thank you.
Thank you, Councillor Davis. Certainly, I've visited your ward and your long-term facility during Canada Blooms, and I've visited many others across the city. Clearly, vital resources in our local neighborhoods that is not keeping up with current trends, particularly since life expectancy is increasing, since the age gap between men and women is decreasing, and the flattening of pensions to carry costs is also a contributing factor. Any other speakers on the issue? No? Okay, we can put the motions on the screen and vote on them. Although, Councillor Davis, I don't think we've seen your motion. Okay, we have Councillor Mahevik's motion on the screen. These are all going up to City Council, so you can look forward to another round of debate. All those in favor? Opposed? That is carried. Motion number 2, Councillor Fletcher. All those in favor? Opposed? Oh, got some opposition here. Opposed? And I didn't see a vote from Councillor. I did.
Oh, recorded vote.
Okay, if the clerk can do a recorded vote on motion 2, that's fine.
All those in favor of motion 2? Councillor Fletcher? Councillor Pasternak? Councillor Cressy and Councillor Mahevik? All those opposed?
No guilt trips.
Councillor Ford? The motion carries.
Great, thank you. Now, I think this third motion we haven't. No, it's on the screen. Motion 3.
Oh, there it is now.
Yeah, so we're good.
Recorded.
Recorded?
All those in favor of motion 3? Councillor Ford, Councillor Fletcher, Councillor Pasternak, Councillor Cressy, and Councillor Mahevik. The motion carries.
And the motion we've not yet seen would be Councillor Davis's motion, but you're taking carriage of it.
Yes, it's just being
Tweaked, okay. Well, it's a wonderful event in which we flowers are donated, and we give them out to the residents of the various homes, and it's just a wonderful event. They're potted, mostly daffodils, tulips.
Yeah, after Canada Blooms is over, then I guess they take.
Yeah. It's a wonderful event.
Okay, here's my next motion. It's really good.
Yes, no, thank you for Councillor Davis's motion.
It's my best motion ever.
Okay, it's a capacity assessment. Yeah, we have to make an editor too.
That's good. Family first something. Here we go. Is this my motion now? Okay.
I think we're good. It's edited and ready for a vote.
Pardon me?
It's edited and ready for a vote.
It is ready for a vote.
Yes. So it's motion 4. All those in favor? Opposed? That is carried. So the item is amended. All those in favor? Councillor Mahevik, I'm sure you're going to support it.
Would you like to vote on it as amended? I'd like that. Sorry, having a recorded vote. Joe?
Okay. A recorded vote has been requested.
All those in favor of the item as amended? Councillor Ford, Councillor Fletcher, Councillor Pasternak, Councillor Cressy, and Councillor Mahevik. The motion carries.
Before we go to the next item, I'd like to circulate the letter that I have today to members that I'm going to ask to have included on the agenda. How come you have so many copies? I'll sign one for you.
So has everyone had a chance to look at it? I've been advised by the clerk that this is actually problematic. It's not the jurisdiction of our committee, and their recommendation is that it be tabled at municipal licensing and standards. So it is my duty to rule it out of order and ask the councillor to bring it to municipal licensing and standards, which is a great little committee that has lots of capacity to take on new projects.
And, Mr. Chair, I'm very sad that I'm going to have to challenge your ruling on that, to be out of order and to hear it here at this committee.
Well, obviously, I'm shattered, but I think I can get through the rest of the day.
Will you?
Yeah, even if I lose the vote. So this is not my personal opinion. This is clerk recommendation.
I understand.
And sometimes I don't.
And there's nothing personal in my challenge, Mr. Chair. I'm actually challenging the clerks, not you.
Okay, so we do have to put this to a vote.
By your body.
The chair is being challenged. A yes vote would be supporting the chair, and a no vote would be
Allowing this.
allowing this onto the agenda.
Scale 1 to 10, how shattered? Scale 1 to 10, how shattered?
I'll get through number five. Yeah. So all those who support.
You might not even support yourself, Mr. Chair.
What you're actually voting on is a motion from Councillor Fletcher to add new business on the agenda. The chair has now ruled that motion out of order. So you have now challenged the chair in terms of whether the motion is in order.
In order. Thank you very much. That's why we've got the big gun.
Okay, so my earlier comment, the no vote is not allowing it on the agenda. So I would now cast the vote. Those that usually ask who's in favor of adding it to the agenda.
Of upholding the chair.
Oh,
No, but that's not.
It's upholding the ruling of the chair that the motion to introduce this item as new business is out of order.
okay, fine. All right.
Yes is with ruling, no is to add the item. Right.
Well, that's
He's
right.
not really that shattered. He's
But then you jumped in.
Wanted to explain.
Well,
All a yes is with kind of shattered.
okay.
Okay, let's start again.
All those in favor of upholding the chair? Against? Okay, that loses, and this item is added to the agenda,
Thank you,
Carol.
members.
unfortunately.
Carol, you have
Now you have to vote to add the item to the agenda.
Oh,
Okay, we need a second vote to add it to the agenda. All those in favor? Opposed?
stop that. Wait till you see the things the kids did. Okay. This is an urban-suburban divide here, for sure.
All right, we're on item number 3. Councillor Cressy, you held the item.
I have no questions of staff.
On this item?
Item number 3, 2018 allocation recommendations for Community Investment Fund and Community Service Partnerships Fund. Any questions for staff? Any speakers?
Just very brief.
Councillor Cressy?
I held the item for Councillor Layton, who I'm afraid had to go, and it was just on his behalf to speak in support of the recommendations, but also in particular to highlight recommendation number 4, which is to provide support to the Toronto Aboriginal Support Services Council. This is a recommendation that was adopted by, to find funding for task that was adopted by the Aboriginal Affairs Committee, which Councillor Layton chairs. And I just want to note on Councillor Layton's behalf what a significant step this is in line with the TRC recommendations coming from at the federal level. And so with that, I'm pleased to support the staff recommendations.
And I would just, I will also support the staff recommendations and note that in the past, there have been, there was a desire to more evenly spread grants throughout the city and particularly into neighborhood improvement areas, areas with model schools, and that our staff have been working diligently on that. And we certainly have much broader reach for all of these grants than by the Councillor Pasternak, yourself and others in saying, let's make sure we're spreading all of those dollars. So I just want to thank the staff for that approach and say that these dollars are working very well to build community right across the city of Toronto.
Thank you, Councillor Fletcher. Any other speakers? No? We can vote on it to adopt the staff recommendations. All those in favor? Opposed? That is carried. So item number 4, Councillor Fletcher, you held the item down.
I'm sorry. Yes, I did. I just wanted to be able to ask some questions of staff on the status of negotiations on shared use agreements with the Toronto District School Board. And yes, but of course, visiting councillor would precede me.
I mean, I don't care which order we go in. Okay. I have some questions.
Councillor Davis, questions for staff?
I want to understand if you could just give us a quick update on, because this is now dated, because it was written some time ago, where we are with the negotiations and clearly highlighting what the outstanding issues are.
Okay. Mr. Chair, through you. We're negotiating an exclusive and shared use agreement that will consolidate all of the 26 standalone agreements that have expired sometime between 2002 and 2006. We've been trying to negotiate this agreement, as far as I know, as early as 2009, and I'm aware it goes back even further. And we have come to points where we were really close to an agreement at times. Right now, as of the end of last year, we were in agreement on a number of high-profile issues. However, we were advised that this agreement is now under the jurisdiction of Toronto Lands Corporation, not TDSB anymore. We have met with them in early April to outline the items, and they have advised us that they have a completely different form agreement. They need to take everything and put into that language and send it to us for our review, and then we'll continue looking at the outstanding issues. So that's where we are. We followed up twice. We haven't received that yet.
Okay, so we're back to square one.
We're back to square one.
Because we're now dealing with the Toronto Lands Corporation for these agreements that have been expired since 2001. And this is the 5th report that I have requested to come here to get a status update on the negotiations. And I've been told we're close, or they're unresponsive. What steps can we take that will force the school board to come to the table, such as giving them notice that we're not going to pay them, or some other steps that they will take us seriously in this, because this is ridiculous?
Mr. Chair, through you, we have Mr. Dale Miller from Legal Services that's negotiating on behalf of city, so I'm going to pass the question to him to respond.
I'm not sure that a holding of rent would work in this scenario, just on the basis that we're currently in overhold and the terms... Sorry, and the terms of the original lease, we're in overhold on those terms. So to not pay rent would be a breach of those terms. I would suggest, I think, Anne has said before, that we could potentially get council to write them a letter to come to the table and negotiate. They did come to the table at the start of April. So we are expecting a new updated lease to arrive very shortly, and we have chased them up twice. So, yeah, we're waiting for them to come to the table.
Sorry. You're expecting them to come to the table. They've been waiting 5 weeks for a response that they were promised at the beginning of April. Nothing.
Well...
So Mr. Chair, I don't even know what to say. I do think we have to take some kind of action that will wake them up. This is the, well, you know what? I'm getting into speaking, so I won't, there are no other actions that we could take that you're, so it's up to the political level to do something, is what you're saying, basically.
We have been advised there are no other options since we're holding over with the expired agreements. Not paying rent would constitute a breach on our end, and they can technically lock us out. So it's really important for us not to disturb the service levels to the community.
And we didn't pay them before for over 2 years. Did they lock us out?
No, but we have not paid them the full amount. We have paid a base amount for permitting that allows us to take advantage of a beneficial permit rate. It was only 1.1 million that we did not pay. Our annual transactions with them are close to $10 million.
$10 million we give to the school board annually.
Correct. That includes
pools?
Permits and the exclusive or shared use portion.
Okay, thank you.
I have some questions.
Yes, Councillor Fletcher. And Councillor Davis, give some thought to whether you want this to finish up here or whether you want it to bounce back up to council.
Or to the next meeting.
I am going to move something to city council.
To go back up? Okay, fair enough.
Okay, I just want to know, there's 26 agreements. Do we have an understanding of where all of those locations are?
Absolutely, and we do a regular inventory of the rooms and square footage every.
So I'm just looking at the locations. If the
Yes.
number of schools, how many would there be?
26 schools.
26 schools. And do you have that list here?
Yes, I do.
Could you tell me what they are or pass that around? Maybe we should stop so we could see that list. Have it
Will
circulated.
I read them?
I'd like it circulated, Mr. Chair.
We can circulate through the clerk.
So if we could just stand down for a minute and have that circulated, that would be helpful.
I have a couple questions for staff as that's being circulated. It's my understanding that when we give a school or school board Section 37 funds, that no funds can be released before a community access agreement is executed. Is that correct?
I'm sorry.
When we give Section 37 funds to a local school, the funds cannot be released unless a community access agreement is executed. Is that correct?
That's correct for Section 37 funds, yes. So in all of the new arrangements, agreements, that's the case.
All right, so we don't have to worry about those kind of.
We do not know.
deals.
They're
Now, with our pool funding agreement, that also is exempt from there. We fund, I don't know, are we down to 32 pools or whatever? They're a $5 million agreement.
right.
Is there an umbrella community access agreement with that, or?
They're all covered under the pool agreement, which is different than exclusive or shared use agreement, and that gets renewed every 5 years.
So after school hours, a community playground, Councilor Mahavik, if you could just, after school hours, the community playground is open to the general public. Someone can go onto school grounds and use the playground or the green space there. That doesn't require a community access agreement, does it?
That doesn't, no.
Sort of a general principle. Okay. Thank you very much. Councillor Davis, what would you like to do with this? And do you have someone to take carriage of your motion? Councillor Fletcher will take carriage of it again?
Yes, but I'm waiting to see the locations.
Right, but that's.
I'm asking questions
Oh,
about
you're
them.
going to ask us, okay.
Well, unless you want to just read them all out, but I don't want to take all my time.
Yeah, I didn't know you were asking questions on specific locations. I thought it was more for your information. Remember, it's going up to councils.
No, you know, I do remember it's going up to council, but we're here in committee, and we have a chance to do things in committee that we don't have a chance to do in council, Mr. Chair. So that is the situation. Unless they're proprietary and we can't know which locations they are, I would have assumed we may have attached that here, but we haven't.
Okay, they're on the way.
So why don't you just stand the item down while we're waiting for the locations? Because I'm going to send those up. I may send them up, depends on where they are and what the issues are. Well, yeah. What would you like to do? We're in your hands, Mr. Chair. We're in your
Okay,
good hands.
so we're going to go to 5, and Councillor Fletcher, you held number 5 down. Although,
Yes.
okay. Now, Councillor,
Everybody is so helpful. All I want is the list. Is that a
the
problem?
list is on the way.
Thank you very much. Do I have a
assure you.
right to just see that list?
You have a right
Thank
to
you
see it.
so
It's a
much.
public document, and it is on the way.
Thank you very
Councillor
much.
Fletcher, we are also on item 5, which also has...
You know, we're on this item 5 that I sent here, and I don't know if we have to go into. Here's item 4, back again now. They're all here.
So we've held item 4 down. We are now on...
We have it. We can just continue. Fix item 4. We may have to go.
Okay. Is it the will of the committee to finish item 4 before going to item 5, which may require an in-camera? Okay. It is the wish of the chair to deal with item 4 now that the list is here. We can finish questions of staff and any speakers. Then we will deal with item 5.
Just on this list, the nature of the, many of these are community centers, rec centers in schools. Is that the list?
Yes, I understand at the time schools and community centers
Pardon me?
were built. Schools and community centers were built jointly, so either city had a number of rooms in a school or has a separate and attached community center on the school property.
That's what you understand? So all of these schools were built, do any of these have childcare centers? Many of them do.
I do not have
Okay,
that list.
so I think we need to be really clear what's in these 26 schools. There's pools in these schools?
9 of them have pools, and 9 of the pools are covered under the pool agreement.
And pardon?
Those 9 pools are covered under the pool agreement.
So this is exclusive use that is a community center, City of Toronto rec center that has its own rooms in a facility.
Let me clarify. It's not a full recreation center. It's a number of office spaces in some of them, and we use the gym or other common rooms through permits in order to deliver programming. So some of them are a couple of offices, some of them include programming space as well.
I'm so aware of so many of them, and some of them aren't exclusive use.
The rooms here are completely exclusive use.
They're completely, so if I asked you at Duke of Connaught what the exclusive use is of, well, that might be the Apple Grove Community Center. I think it's helpful to understand what facility is in each of these. What were we covering? We're covering rec centers.
We have a list of that we can provide.
And to understand that within these, there's 9 that have pool agreements. How many have childcare agreements?
I am not aware of the child care
Well,
agreements.
I think maybe at council we can learn which have childcare agreements, because I know that, I think Secord must. Hillcrest does. Franklin does. Earl Beatty does. Duke of Connaught does. Brown does. Beaumont does. Bedford does. Annette does. Adam Beck may or may not. So there are a whole number of leases with the city already in a number of these schools.
Yeah.
And then we have 25 that are specifically for rec centers or AOCs.
Or, no, rec centers or recreation space.
So in Duke of Connaught, where that is S.H. Armstrong Community Center, where is there 23,000 square feet? that is being leased from the board.
That is an attached community center. That's part of the building.
It's our building.
Community center in there, that's part of the building.
It's our building exclusively, completely separated off.
It's part of the main building that's completely separated off, yes.
And so that was built by the city on school board land, and now we're leasing that land back?
No, we're leasing the building,
Which we built.
yes.
We built a building, and now we're leasing the building.
Councillor, we have always been leasing the buildings, and lease is not a market rate lease. It's a combination of the costs of running the building. It's a cost recovery. So we pay for cleaning, power.
Yeah, we pay
a
for every,
blended
there's nothing
rent.
that they pay for in that building. That's
There is
our
nothing
exclusive
that-
building.
Correct.
And so they gave us the land to build the building, and now somehow we're leasing that. Do we know the cost of any of these leases? What's the total cost?
I believe it's $10 and change per square foot. It's a blended rate that's applicable to all locations.
And for the entire exclusive use, what is the total value of all of these leases?
That's not a high amount. It's about $1 million, under $1 million.
Under $1 million. Do you think they're going to try to get more money?
The issue is not money, Councillor. The issue is TDSB is taking the position that we can only access these spaces from 7 a.m. to 10 p.m. during school hours. So Saturdays, Sundays, and school holidays, such as PD days, they're asking us to pay for additional opening and closing of the building in order to access to our exclusive space. That was one of the major issues that held up the agreement. We don't have a key. We require them to open the doors for us and look it after.
So if you could let us know for council which ones have a childcare center, because that is opening on PA days and holidays.
Yes.
At 7 o'clock, so that's gone. And interesting. So the issue is PA days and holidays?
You could,
PA days and holidays, we are requested to pay an additional fee in order to open and close the building.
Okay, so ones that are, I just want to be clear of what I want, Mr. Chair. I want those that are standalone beside a building, like Duke of Connaught, S.H. Armstrong. Fairmount Community Center is completely excluded. You can close everything off. There's no building to open and close outside of ours. There probably are other ones like that.
Yes.
So which ones are those? Where are their pools? Where are their childcare centers? So we actually see the whole scope of what goes on in all of these schools. Would that be possible? Because I think this is going to council, so it would be helpful to have that information laid out. I said pools and rec center. Pools, childcare centers, AOCs, and rec centers in all of these facilities,
We'll
26.
prepare the full information.
That would be
for
fantastic. Thank you so much for that.
Thank you, Councillor Fletcher. Any other questions for staff on item 4? Okay, I'd like to go to speakers, and I understand there's a motion to just send it right up to council so we can continue this debate there. I am of the understanding that nobody is denied service here, and that basically in other programs and services, we're propping up the school board to about $25 million a year when you add all.
I take offense to propping up. These are community facilities that we are using together. So I just ask you, Mr. Chair, not to call that propping up.
Well, when you
I'm asking
read
you
through
not to
the
do that.
Constitution, education is clearly provincial jurisdiction.
Mr. Chair, I'd love to speak.
Okay, Councillor Davis.
Thank you. As I said in my questions, this is the 5th time this has come here to discuss the outstanding lease agreements, which we called shared use agreements. They weren't leases, from what that I understand, but maybe they were it was just different terminology. But yes, of course, we built in the urban core joint facilities in order to use the land efficiently and to find some economies of scale sharing buildings. However, despite what the chair said, there have been instances such as at Brown School, where the school board reclaimed the space and took away space from our recreation center. 4 years ago, they tried to reclaim space at Glenhill School, and we put a stop to it and said, no, it's our space, and we want to continue using it for recreational purposes. The motion is simply asking the mayor to convene a meeting with the chair of the board along with the director and the senior management team to get the most senior people at both the school board and at the city looking at this and trying to get some more pressure brought to bear on bringing this to resolution. I was stunned to find out that this has been, not only has it shifted from staff person to staff person, it is now shifted to the Toronto Lands Corporation, and they want a completely different template and form for the agreement. I was assured at least a year ago that we were at the point of reaching an agreement, and here we are again starting from scratch. So this is an extremely frustrating exercise, and Councillor Fletcher is right. We use our facilities as hubs, schools as hubs of our community. And yes, they are funded by city dollars and school board dollars. The reason that the school boards stopped, at least in the former City of Toronto and East York, providing this space for free was that the provincial government stopped allowing the school board to use school board funds for community use of schools. And as you know, the funding for school boards tightened and tightened, and I know the chair should know this. The school board has been forced to look at increasing their permit charges for all users. This was a crisis right after these changes went into effect 15 years ago, but it has not been resolved when it comes to probably the largest user of school space, and that is the City of Toronto. So we need to bring these discussions to a close. We need to understand which space is ours. We have schools that have crept into using our space and now have occupied and are using our recreation space. And while they're using it, I'm sure, for good school purposes and programming that schools need, it takes away space that we could be using for recreation purposes. So we did discover 2 years ago at least that we were paying 3 times over. In the pools agreement, we were paying for caretaking. We were paying for permits on top of that for caretaking. We were paying for childcare centers to be opened. We're paying for caretaking for those childcare centers to be opened. So I do think there is a duplication, and that we've been a bit duped, I'm sorry to say, over how much we are paying. And I think it's time that we get these understandings clarified, and to use the Auditor General's language, value for money. I can't believe I just said that. Okay, thank you.
Thank you, Councillor Davis. Now, Councillor Davis's motion is on the screen, but Paula, Councillor Fletcher is going to move it and speak to it.
Thank you so much. Yes, I am. I'm moving that motion, but one of the things I would like to see done by the mayor and the chair of the board is it's time that the school board and the city actually had a joint statement about the importance of venues that are in the communities that are being used by both parties, and the long-standing relationship between school boards and the City of Toronto to deliver childcare, to deliver rec services, to deliver pools as spaces that the community has, and that the city has engaged with the boards for many years, including building some of these facilities. We know that pools were actually constructed by the city inside schools. We know that, I look on here, Franklin Community Center, it's called Community School. It was built as a joint institution. The city and the school board partnered to build that. The same with the Harbourfront Community Center and the school board, they partnered. These are all on the same piece of land. So I think it's time that we reiterated that, and I believe that our mayor, current mayor, and the chair of the board would be up for that. The public is simply tired of fighting over using spaces that we paid for long ago or that they believe are sitting right in their community. I understand that all of the properties, and it was indicated by our staff, have gone to Toronto Lands Corporation. So they're in a process right now at the school board of looking at the transfer of their lands to Toronto Lands Corporation, much the same as we're transferring our lands to create TO. So I know that it's a bit slower than usual, but I believe that a joint statement where we're talking about how important it is to find ways to use those properties together is time. The time has come for that, and I'm going to be asking the mayor to do that when this motion comes to council. There are 26 locations here that the community has been in forever, and we have built, the Beaumont Road is actually the Fairmount Community Center. So they listed as their school. It really should be listed jointly as Fairmount Community Center. The same with Duke of Connaught. It should be listed as Duke of Connaught S.H. Armstrong. They're separated out properties. So somehow that isn't captured in this. So I'm asking the staff, and Ms. Ulusoy has agreed, to come back and say, what is all in these schools besides the rec center? And I would ask you as well to identify the name of the recreation center as well as the school. Because sometimes when we're talking about school pools, it is the Duke of Connaught School Pool during the day. It is the S.H. Armstrong Pool outside of those hours because it's associated with our community center. It's hard for us to understand. The public gets it. They know at what time they're swimming. They don't go to those schools. So that would be also very helpful, particularly with Toronto Lands Corporation, who has to learn this whole file. And I'm very happy to help them learn that file, Mr. Chair. Thank you.
Thank you, Councillor Fletcher. Any other speakers on this item? We just have the one motion, I believe. Put it to a vote now. All those in favor? Opposed? That is carried. And the item is amended. That's all. Okay, we're good. We're good to go. So what we could do, because is, so Councillor Fletcher, are you looking to go into private on item 5?
You have to end up going in.
Okay, so why don't we deal with your walk-on item now so that we've cleared up all the public items so that when staff leave for the private, they don't have to come back. Are there any questions for staff on this, or this is the walk-on item, everybody? Everyone has a copy?
It's a report request.
Yeah, it's a report request. No questions for staff? For the next meeting? Okay, so this is basically enforcement of our dog bylaws regarding cleaning up after your dog and on-leash rules and enforcing them on TDSB properties. Is that a fair synopsis? Yeah, in other words, enforcement is perhaps a tricky issue here and maybe something can be worked out as a blanket policy. So can we put it to a vote?
Well, I'm just going to speak quickly on it because my motion, I want to report to the June meeting of CDR. I'm sorry that wasn't in there because I couldn't send it directly. This item has been on the licensing committee, and I've put this here because I know that there are so many, and they're not willing to deal with that, but we have childcares that we license in over 400 schools, and their school-age care. They all use the schoolyard. That's part of their license agreement. And I think it's very important that where there are hotspots, that we can send, the MLS staff can enforce some of these bad owners that are out there. And these kids at Leslieville did a great study about the impact of having dog poo in the schoolyard from grades 1 to 6, which consequently also covers everybody who would be in the after-school program. That's paid for through the city and through Eastview. So it is, I think, the way we have to go. I thank the committee for agreeing to put that on, and I would just ask that we move this forward with that amendment of the June. Thank you, June 13th.
Okay, we'll bring it back very quickly. An important issue across the city. Responsible dog owners, respect for our playgrounds,
Yep.
safety of our children, very important issues.
Thank you.
All those in favor? Opposed? That is carried. And we can go to the final item. Item number 5 is held by Councillor Fletcher. Suitability of identified property as a proposed shelter. Now, there is a confidential attachment, but we'll determine whether
Well, I'm going to ask about money.
whether that's necessary.
I'm going to ask about dollars, so.
So I would assume we have to go into private. Yeah, so, I mean, there's money on this private document, so I would assume we have to go into private. So if we could, I'm going to move a motion to get us into private. The Community Development and Recreation Committee recess its public session to meet in closed session to consider this item as it relates to proposed or pending land acquisition by the city or one of its agencies.
I can just ask about competing for acquisition. Are there certain things I can ask about?
So is that a change of mind?
I just don't know when I'm going to cross the line to go into private.
Well, we will let you know. Okay, so okay, disregard this motion. We're going to stay.
We may need
Okay.
that motion.
Well, okay. So let's,
Okay.
Councillor Fletcher, do you want
DCM
to,
says go in camera, yeah.
even for public questions? Councillor Fletcher, if you have public questions, let's do them now.
I don't know if they're public.
If they won't answer.
It's on purple paper. Okay,
Well,
away we
if it
go.
regards money,
It's in the purple paper report. The purple paper. On the purple paper report.
No, you read it out.
okay, so the motion before us is to go into camera.
You want to leave and I'll chair because you seem like you're.
No, I'm fine, Why, do I seem edgy? I will say I ran out of coffee here. Okay, so any members of the public, the media, or staff that are not tied into this issue should leave the room. And we should vote on the motion. All those in favor in going into private? That is carried.
Now we have to take a minute, don't we?
We should wait till Great, so we're back in public session. Any questions for staff and public? Any speakers? Councillor Fletcher, I understand you have a deferral motion. June 13 is our next. June 11th. It's June 13th and July 11th.
Okay, sorry. It's July 11th. We had them requested.
July 11th, yes. Okay, all those in favor of deferral? Opposed? That is carried. Thank you very much, everybody, councillors, committee members, city staff, clerk's office. Thank you so much. Enjoy the rest of the day.
2 signatures.